is our 340 roundtable event, Pandemic SOPs, Today and the Future. Elizabeth Park, Peter Koshland, I'm going to let you guys take it away.
Okay, I could begin. And I'm Elizabeth. My background is regulatory consulting. It's not very specific to compounding. I'm more focused on really working with community pharmacies, particularly long-term care, in establishing their standards of practice to ensure compliance, both state and government. Can you guys hear me? My microphone is a little far away. Okay. So that's really my background. I do run a consultancy firm called Simplified Medicine, where I employ different types of specialists and experts, all types, going from pharma to compounding, sterile and non-sterile. So that's kind of what I do, to give you a background of where some of this information is coming from. I've noticed that lately, we have the Board of Pharmacy self-assessment that lists all the minimum required policies and procedures, and most pharmacies comply by either working with the consultant to produce those or purchase them pre-made. And they sit on the desk for years and years in their, original shrink wrapping. But I've realized that lately, when they're coming into the pharmacies, they're requiring the pharmacies to have policies and procedures on COVID, whether they're providing vaccines or not, whether they're doing point of care testings or not. And I realize there's an abundance of resources that is made available to pharmacies, but there's just so much. So I hope to identify some of the main ones that I think pharmacies need to have, both for the protection of their own employees themselves, and also so that they know what to do in the event one of their staff members tests positive, both in terms of compensation for their staff personnel and also safety precautions for at work exposure and whatnot. And so we'll kind of highlight the things that I've mentioned within the policies, and I recommend for all pharmacies to have this, even though it's very basic. It's very, very basic, but the information is critical, and the board really requires pharmacies to have this conveyed to all their employees. So that's kind of my bring on today's talk.
Yeah, I guess I'm coming at it more as the owner's perspective. So I have a compounding only 503A pharmacy in San Francisco. We have about 35 employees. And I'm glad this is a roundtable, because if I had done a PowerPoint for this 2 months ago, it would be completely outdated, because things have continued to change. Clearly early on in the pandemic, it was all about protecting our staff primarily, and then also trying to maintain service to our customers and making sure that we could get the medication supply and make sure that their needs were being met, and kind of balancing all that out. Now we've gotten to a situation where we've actually gotten our entire staff vaccinated. So we did a big push to get that happen, to get 100% vaccinations. I'd love to talk to you, Elizabeth, a little bit about some of the legal allowances around requiring vaccinations. We did not require vaccinations. We just highly encouraged. I really did a sales job with my staff to say, let's just get everyone vaccinated, and here's the reasons why. And thankfully for us, that really worked. And we got 100% adoption. And so now we're really thinking about, how do we get back to normal? How do we unwind all of these restrictions in a really thoughtful way? Of course, with the legal ramifications, and we have a very robust SOP for COVID that we present to our staff constantly, so that they're really up to speed. One of the things we faced during the middle of the pandemic was just fatigue, like we saw from everybody, and just kind of reminding people to stay vigilant. And my big concern was just spreading COVID throughout the staff, since we were still showing up to work every day in compounding pharmacy. You can't do it from home. So fortunately, we were able to kind of continue to communicate that. And now we're working with our staff to think about how we're going to kind of return to quote unquote normal. And obviously the legal requirements around that are important. But I think just as important for us are the emotional, social feelings about, from our staff and our patients about what they're comfortable with, and really trying to take the temperature of our entire staff and, make sure that we're doing things in a really thoughtful way, and that their voices are heard, so that we're not putting people in situations that they feel really uncomfortable with. Even if we're doing the legally correct thing, we want to make sure that we're also doing something that gets everybody really feeling safe as we start to kind of unravel these strict restrictions around our COVID protocols. So that's kind of where we're at now, and I'd love to hear thoughts on that. I certainly can talk more about what we've been doing as well. So,
okay, should we just jump in?
Yeah.
I'll throw the first topics out there. I mean, we obviously know how to identify the signs and symptoms of COVID, but at the same time we don't, because it's ever evolving. So that I think the most appropriate source that I always like to identify is the CDC, that on a routine basis, they kind of identify the things that can give us an idea if the patient may or may not have COVID. But the important thing to notice here, and I'm going to come from the point of the perspective where trying to clear up any misinformation that we have heard or seen, is that signs and symptoms may appear 2 to 14 days after the exposure to COVID, the virus. So a lot of people come in and say, we don't have the signs and symptoms, we don't have fever, we're fine, we don't need to wear a mask, or we've received the vaccine. We're pharmacists. We know the vaccine has, identified several strains and the most common ones, but it's not all of them. So it is still very safe practice to keep your social distance 6 feet apart, wear your masks, hand hygiene, but also at the same time to spread awareness that these symptoms may appear 2 to 14 days after. So if you don't have symptoms, if you don't present with fever, does not mean you don't have COVID. It is hopefully unlikely, but at the same time, it does not completely eliminate the fact that you may have COVID. So please practice, all the precautionary measures. So I think that's my first pet peeve, if I like to say, when people come.
Can I jump in there, Elizabeth, and just share something? We realized because of that there was a hole in our COVID protocol where when we had a policy that if somebody was exposed to a family member or person, direct exposure of a COVID positive person, then that was considered an exposure, and they had to take a 14-day quarantine and get 2 successive negative COVID tests before coming back to work. But what we didn't think of was people who live in families where somebody had symptoms. And so they hadn't gotten their positive test back, but family members that they were living with had presented with symptoms of COVID. And actually that person had come to work. The next day, their family member tested positive, and then that person tested positive. So we actually closed that loophole later to make sure that if somebody in your household that you live with has symptoms, then we're considering that an exposure until that person has a negative test or you have 2 successive negative tests. So I think that's a really important point. It's really out there. It's important to try and get all that in there.
So, thank you for sharing that experience. Those are the 2 things I always like to begin with when I'm hired to speak about COVID, just to educate, to spread that awareness that because we have the vaccine also, it doesn't mean that we're completely covered. There are new and evolving strains. That's what viruses do. They evolve. And so the second thing that kind of brings us to the separate issue is testing. We have tests that are made available, and as pharmacists, we know that there's 2 types of tests. There's the antibody, and then there's there's a viral test, and then there's the antibody test. So a lot of people, the common public does not know how to differentiate the 2. So when their employers, non-pharmacy related employers, offer these 2 options of testing for them to go back to work, they test one of them. So if they test positive for an antibody, yes, they may have had exposure at the very beginning, but they're no longer positive. Or if they test negative for the viral test, it may also mean that they still don't have the viral load necessary to test positive for COVID. So one thing I like to really educate on staff members, and this is not really directed towards pharmacists because pharmacists know, but the staff in pharmacy includes the clerks, the cashiers, the techs, and it's just to educate them on the 2 types of COVID tests. So if you test, for example, positive for a COVID-19 by a viral test, I have a specific policy that they follow. And if you test negative for a COVID-19 test, I let them know that that's only at the time of testing. So you can't go out drinking at a bar, if you test negative, then you might get exposure at that point. So it's also letting them know what it is you're testing them for, just providing that education and a distinction between the two types of tests that are available. So I think that's one other point I like to highlight. I know, Peter, when you were saying earlier about temperature checks, one issue that I've had with pharmacies is employees like to maintain the confidentiality of having their temperatures checked. So one way we came about a process to make that work is to have the temperature checks happen before the employees enter the facility, and develop essentially a shoe box with a thermometer on top, clarifying what is a temperature, what indicates that they may have a fever and are febrile, and having them take their own temperatures, write their names, write the temperatures, identify any of the symptoms that we may want them to let us know if they have, and if the temperature is below, 100.8 or whatnot, let them come into the pharmacy, but at least nobody sees their temperature readings before they walk into the pharmacy. And at the end of the day, the PIC or the owner can go and verify that everyone that has worked that day has in fact followed that policy. That was the only way that we could think of to maintain confidentiality of the temperature reading, so to keep the identity of the employee with a fever confidential because, of common fears. So,
yeah, we actually used our pharmacy software that we use to maintain our daily processes, and we built in a pre-screening for every employee that would check their temperature and actually have them go through the symptoms and also check that they didn't have any of the symptoms. Because it's a pretty long list, and we kind of think everyone remembers that list. Oh, maybe they forgot that loss of smell or taste is something that we would consider the indicative symptom. So we actually built that into the software. They would walk in with a computer at the front counter. They'd have to check their temperature, plug that in, click save confidentially into their profile, and then if all the answers were correct, then they can proceed with going on to the day work. So
that's very robust. That'd be ideal if most pharmacies could do that. It's just technically difficult for the smaller independent communities. But I suppose the compounding ones at least will have that opportunity, given that they hopefully share similar softwares.
So what are your thoughts about vaccination now that that's becoming a real option for pharmacies? Hopefully most of the people now who are at least on this call have had the opportunity to get most of their staff, if not all, vaccinated. Mm-hmm. From a legal perspective, what is the guidance around that?
I mean, I could give my personal opinion on that issue. Yes, absolutely. We need to take advantage of the vaccine that's available, the strains that have been identified. I personally have been quarantined at home, so working from home. I have not left my house, so I've taken a step away to allow those that need the vaccine to get it before myself. I did get opportunity to receive it sooner because I was a healthcare worker, but I didn't want to cut in line. So my husband and I both will receive the vaccine. We have twin baby boys, so we'll have to get it sooner now that we feel like we're eligible. But definitely need to get it now that we've identified those few strains. But I do think that the COVID vaccine will likely be like the flu vaccine, where yearly they'll identify the most common strains that are available, and those strains will be the ones that are most important for that specific year. As it relates to, prioritizing, I think the vulnerable population is the one that needs to get it most importantly first. My background is with geriatrics. Geriatrics is my training. So I always encourage the elderlies with comorbidities to prioritize them in line. I'm an advocate of the vaccine, but there's not much more I could say because I haven't really done a deep dive into understanding any side effects or hearing of any side effects that would be so detrimental that would cause for me to have fear and not get the vaccine.
Yeah, so now that we've had our entire staff vaccinated, we're starting to roll back some of our requirements based on some of the CDC recommendations and just general sentiments around our staff. We're taking it in a very gradual approach. We did wait until the final and last person in our staff had gotten their second shot and had waited 14 days, which is per the CDC guidelines. That full immunity is assumed at that point. So we have now taken away our initial temperature screening and symptom screening for all staff. We've also taken away the 14-day quarantine for symptoms, and we've turned that into a 3-day quarantine just for general health and wellness of our staff. We're assuming that COVID is not going to spread rapidly through our staff now that they're robustly vaccinated. We're allowing people to sit together at lunch. And that's pretty much where we left it. We're still not having people come into the store. I think we're maybe more conservative in that regard. And we're not letting vendors come in for like FedEx, UPS. They're still letting stuff outside the pharmacy. So that's kind of where we're at now, and we're kind of trying to figure out, next steps for phase in, how to do that. Interestingly, we also, we've always had almost universal masking and gloving requirements. We've allowed people to not have to wear gloves. We've allowed people, unless they're obviously in the hood or something like that, where they need to do their compounding. But interestingly, people have had, people are just sticking with what they're comfortable with. I think interestingly, people have adapted to the requirements around masking, gloving, distancing, and just because we've just said, okay, we can lighten up, they're really not doing it. They're still very cautious, and so we're going to see how different employees respond to, their comfort level with kind of re-engaging, to a pre-pandemic way of life. Even like in our break area, everyone had to sit 6 feet apart. Now we're saying you can sit next to somebody since you're all vaccinated, and that's also per CDC guidelines. People still aren't doing it because, it just feels weird now to sit next to somebody because they're so used to, thinking that's dangerous. So it is interesting. I think that's kind of the current state we're in. And in, in the next coming months, it's going to change again. And probably throughout the year, we're going to see different ways of kind of adapting to a new normal. We're going to reemerge to something that wasn't pre-pandemic. It's going to be something new that's going to incorporate probably some of what we've known. So I think that's interesting. That's kind of where we're at with our pharmacy as of today. All the stuff that's happening in the last 2 weeks. So.
Mm-hmm. A lot of the clients I consult, there are quite a few of them, they've been hesitant to loosen up their policies, even with the vaccinations. And when they've asked for my advice, I've said, it's always good to socially distance. Everyone should always wear masks because pharmacies are inherently very small spaces. So it's good to keep your masks on. So at the very least, I've recommended for them to stay consistent with the mask. Gloves, not really required. And quite honestly, the CDC, from the beginning, they did not recommend gloves unless it was delivering patients' medication. So gloves didn't protect from the spread of the virus itself. So I've been a strong advocate of maintaining the social distance and maintaining the masks. Temperature checks, I've never been such a fan of, but I've done it because what the CDC has required, and particularly because by the time you have temperature, you probably have symptoms and you feel febrile. So it's already a little later than we would like to know when someone presents with COVID. So I agree with you, Peter, on all the things that you're doing. I probably would like to see more people keep the masks on and the social distance until we better understand this virus and the evolution of the virus, even with the vaccine and the vaccinations. That's just my take on it and how I've been consulting the pharmacies that I've been working with.
I think every pharmacy has to make that decision for themselves. Clearly, if your staff is totally vaccinated, the CDC guidelines allow you to be maskless. But again, and their guidelines are really more about, friends and family getting together who are all vaccinated. So we're kind of interpreting that for our business purposes. But again, being cautious is never a bad idea. And yet, I think if we risk that if we're overly strict, if we keep, if we encourage our staff to get vaccinated, if we tell them there's going to be benefits to that, and then we keep very, very strict processes in place, we're kind of undermining that opportunity to kind of scale back some of the really burdensome, things that we did to protect ourselves. So that's the fine balance we have to have, and I think that's part of it, and for me, the gradual approach is the way to go, because you can do a few things, you can see how people respond, talk to people, how does it feel, we opened up a whole bunch of lunch area where we had to socially distance for lunch. And now we're saying, well, if you want to sit with your friend, it's okay according to these guidelines. You're both vaccinated, so that's in accordance with their guidelines. But we didn't take away those extra lunch tables yet. We're going to allow people to, and then kind of see how they recalibrate their comfort level with each other and things like that. And then, of course, the big X factor for us is what about customers and patients coming in? Because you just don't know what they're bringing in. You don't know if they're vaccinated. You don't know their hygiene. You don't know if they're feverish. Question. And I think for now we decided to keep them out of the store. And some of our staff have been very happy with that decision at this point. However, there will be a point where we'll need to bring them back in. So we're going to have to just kind of keep monitoring that and make that careful decision when the time is right. I think a lot of that will depend on the external world, what people's comfort level are outside the pharmacy. Are they more comfortable going into stores, going into coffee shops, restaurants, maybe even now that they're trying to open up? I think that will kind of influence us as well, kind of just seeing what life on the street look like. So it's an ongoing project.
It is. It's very ongoing, and it really depends on the area, the patient population. I've had some pharmacies who've opened up the opportunity for patients to come in, and they'd prefer not to. They still want to, even with the vaccine, they want to maintain their ways of that they're now used to it. They don't want to sign for medications because they don't want to do it anymore. And so it's another issue with, PBM audits. Do we force them to sign for their prescriptions, or what do we do now? So it's a very much of a, it's slowly evolving into a new comfort, new ways of doing things, which is not necessarily bad. It's new, so we have to find the norm that could work for us.
Right, and things like PBM audits, I think they're allowing for, no signatures. I know deliveries are now signature free, and that's acceptable. That's going to change eventually, obviously, because they're going to want to go back to their old ways. So that's also going to influence some of our decision making. We don't do third parties. So the PBM issue isn't as big of an issue. I think part of it too is just what our patients are comfortable with. Like right now, I get zero complaints about not being able to walk into the pharmacy. People love us. Like we're carrying stuff out to their cars while they're on the street, and they love that. So again, part of that is like if it's not causing problems, if I'm not getting complaints, then I don't feel an urgent need to change it. But I do want to continue to monitor, because I think people's expectations are going to start changing as the general public is vaccinated. And as of reports now, by the end of May, we should have almost every adult vaccinated in almost every state. And even they're even saying some states by the end of April. 40 states now are going to be all 100% vaccinated. So that will definitely influence people's expectations. So I think it's like as an owner, I have to listen to my staff. What's their comfort level? How do I keep them safe and protected? And what are our customers' expectations? And how do we bridge those two things? And so far, so good. So we'll just keep monitoring it.
Yeah. One thing I also like to talk about the staff members when I'm there with, it sounds very primitive. I almost teach that to my, my little kids in elementary school, but it's hand washing hygiene, that how long you have to wash your hands for it to be cleared of any bacteria or viruses. And so that's the first thing. So what I've done is I put a sign up just like in my own house for my own kids, wash your hands for 30 seconds, sing the happy birthday song. It seems very primitive, but when we're in a rush and our minds are somewhere else while we're washing our hands, it's hard to it's hard to do a good job. And one other thing I like to highlight is, I think this is my own personal pet peeve, is coming out of microbiology background, is hand sanitizers. You don't want to overuse it and abuse it where you're killing the good bacteria on your hand. You want to reserve using the hand sanitizer for when there is no water available. And One other thing I also like to highlight is the correct amount of hand sanitizer to use. Each one has their label. And I always take a survey of every pharmacy I've been to. I asked, have you ever read the label on the hand sanitizer to know how much you should use? Not one person has ever said that they've read the label. So these are like very primitive issues, but honestly, if you don't stop to think about it, you wouldn't think that, you need to wash your hands for 30 seconds for it to do something, or the hand sanitizer has a label. Really, we kind of overlook those things, but as pharmacists, we know how important these labels are.
Yeah, one other thing too, I think is interesting and really came into view when the pandemic first hit and we had to enforce 14-day quarantines, and the hand washing is a big deal. Like, one of our policies is if you ever walk inside the building from the outside, you have to wash your hands. So we're just going to assume your hands are contaminated with COVID and just really get disciplined about that. And what was interesting when we first started was how undisciplined we had been before the pandemic. People would come to work with runny noses and, oh, we don't want to be short-staffed, so we're going to deal with it. And the next thing you know, half the staff has a cold, but they still show up. And we really had to get disciplined about making sure people stayed home, people washed their hands, people kept their masks on correctly, all that kind of stuff. And it was quite a heavy lift at the time. I really hope one of the benefits or silver linings to all this is that we stay disciplined like this. Because what was amazing was, even though we had 2 staff members test positive for COVID, the disease never spread throughout our staff. There's 35 people who are all working together in close quarters. All that gowning, garbing, hand washing, masking, that protected us, prevented a really catastrophic spread throughout our pharmacy. And so, yeah, a common cold isn't the same as COVID, of course, but I don't want that kind of stuff to continue to happen. And I think our staff was saying, this is the healthiest I've been. I haven't gotten any colds since last March. And it's all because of these things. We know this intellectually, but we've really been able to test it out and be disciplined about it. So I want to really try to keep that discipline. We're not enforcing 14-day quarantines. We're enforcing 3-day quarantines. But still, in the past, we didn't even really do that as well as we should have. So that's something we're going to take going forward, is really it's not fun to have somebody out sick who had a fever a couple days ago, but it's better than them getting all of us sick. And we really just don't want anybody with any sort of bugs floating through the pharmacy. So yeah, new level of discipline was the order of the day, and we hope to keep some of that.
Yeah, I like to take the positives that we've learned from COVID, because we always hear the negatives everywhere, but there are a lot of good things that we've learned, and you're very right in that we neglected how dirty our hands were and how bad some of our habits were. I myself have been guilty of going to school and work with, runny nose. But luckily, with some of these practices in place, none of the pharmacies that I've worked with had COVID spread, and each one had 1 or 2 pharmacy personnel come up with the virus, and they practiced the safety precautions that were in place, and they had, they didn't even have N95 masks. It was just the basic masks that we use in the hospital, and they were fine. No one got COVID, luckily. So yeah, I think there are some good things that we've learned. Hopefully we've, built the habit, and within the 14 days, year and a half, that will continue to stay in pharmacies and abroad and everywhere. But I think we have one more person joining us. One thing, several things that or references that I'll highlight, but one other point I want to discuss to make sure everyone adds within their policies and procedures is the degree of compensation that an employer must pay that employee during this quarantine. You don't really necessarily have to describe that within your COVID policies procedures for standard operational practices, but within your employers' manuals, that is definitely something to consider including, so that it's flexible, non-punitive, and consistent with what the public health guidelines suggest, and that your employees are aware of this and they understand these policies. So to avoid any confusions, you want to make sure it's non-punitive, so that when your employees are sick, they stay at home to protect yourself and your pharmacy and your patients. So I think that's one important point I've seen many of my pharmacies miss within their policies, and I recommend for them to internally discuss and decide what's right for their pharmacy.
Yeah, and a lot of those benefits that came out of the early pandemic relief basically paid your employees wages if they were home, even in the absence of positive COVID tests, just with symptoms. So if somebody was symptomatic and had to do a 14-day leave, you had 100% replacement of their wages from the FFCRA program, and 2/3 of replacement of their wages for caring for a child. So I was always amazed when I heard of colleagues who weren't implementing those programs, because it takes away the disincentive to lie or, be just, dishonest with yourself about how you're feeling, because there would be no real financial disincentive to having a medical leave, or, needing to have a leave to stay with children who can't be at school, et cetera. So we really went out of our way to make sure that that was available. We even opted into what was called EFMLA, which was an extended FMLA program that we weren't required to because of our size, but we felt like we really wanted to offer that as well, which was really more about caretaking leave and pay. A lot of those leaves got extended to March 31st, and I think with the CARES Act, they've been extended again. So I think people should probably talk to their HR resources. We're doing that today, actually, because there's still some confusion about when these plans expire. They were supposed to expire March 31st. Now it looks like there's some additional extensions with the new CARES Act. So, but even if the EFMLA is quite expensive to administer, so that's a decision for every business to evaluate. But the FFCRA plan is really easy to administer. You do that through your payroll, processing, and it just replaces that through a tax credit. So there were some good reasons to implement that stuff, and yeah, it was a win-win for everybody. It was for the win-win it allowed the employer to kind of enforce people staying home, and it allowed the employee to not feel any sort of financial devastation from that leave if they didn't have PTO approved or anything like that. So that was really beneficial. That was helpful. So we're still figuring out what to do going forward, because it is getting hard now, because a lot of people are still taking leaves and taking care of kids, and we want them to do that. Obviously, it's very important for us to have people be able to take care of their children, and we also need people in the pharmacy too. So again, kind of balancing all of that out is an ongoing challenge as well. So
yeah, it's definitely a challenge. So yeah, I mean, the references that I always, push people towards is obviously the OSHA, protecting workers from the coronavirus. They have resources, everything basically you detailed for people to be able to go there and kind of get a step-by-step on how to go about it. The CDPH has resources, the DCA has resources, FDA, CDC. Those are really the top 5 that I would gear any pharmacist towards. Obviously the Board of Pharmacy, but they don't release as much substance information. They gear you towards the professionals that are releasing this content. So these are the resources. I know APHA had a good article for COVID-19 resources as well that I used. It was primary literature, so it was pretty well drafted. So the help is out there, and the information is there for us to use. It's just bringing it all together. But these 5 resources were the ones that I'd recommend for pharmacies to have downloaded. I know that CPHA, the California Pharmacists Association, I actually printed some of the flyers they had made for their members. It was really, really well done, and they spent a good amount of efforts to help pharmacies, for example, decide when a patient needs to test, what types of tests there are, and how to qualify it. It's essentially, try to show one of the flow charts if I can. It's essentially a flow chart that they had created, and they're very well made. The task force was full of knowledgeable individuals that did a good thorough research, and they went from everywhere from recommending for infection control considerations. So they did a good job in bringing it all together. Also, if any of our attendees here want to join CPHA, I think they have it free for all their members to download.
yeah, we used that resource quite a bit actually at the beginning, because it was very confusing what the guidelines was. It's a nice simple way to look at it.
Mm-hmm.
And I'm going to reiterate something you said earlier. Make sure you have a COVID SOP and that your staff has been trained on it, signed off. Because the last thing you want is OSHA to show up and ask you what your process is and have nothing documented. So even just cutting and pasting some of those OSHA guidelines into an SOP is really essential. Because going forward, people are going to be looking for this. It's all complaint-based, obviously, especially with OSHA, but you don't want to be left without any sort of documentation for sure. So it's a really important point.
What I like to highlight is anytime I do the training, I always recommend bring a third person in to do the training. Doesn't have to be a pharmacist, it could be a pharmacy colleague. You guys could cross-train each other's pharmacies. And when you do the training, make sure you sign an attestation. If anything I've learned from what I do in working with the different regulatory agencies is if you don't write it down, it never happens. So write it down, write every detail down, and have the attendees sign an attestation, have them write or the PIC write a policy procedure effective date. Make sure you include within your attestation that they have read, reviewed, and implemented under supervision and been trained on these policies. Make sure that you specify that this new policy supersedes any other policy. Make sure that you include that this is for both paid and unpaid volunteers included. So it's very inclusive. And I always say your policies and procedures binder should be there for your staff and should be at the center of your policy, not for outsiders to have access to, but for your internal staff to know and to have access and to use. So when an inspector comes in, no matter where they're from, everyone should be able to point to these policies because they should have signed off on them, particularly COVID now, because that's what we're talking about. And it's so interbraided between all the different organizations that may come back asking for this. So have your COVID policies, procedures readily available in the pharmacy, signed, dated, and routinely, whatever works for your pharmacy, revised.
And we keep all of our SOPs electronically in our pharmacy management soft system. So everyone has access to it through their login, and it's always up to date there. We're not worrying that pages left in an SOP binder are older versions and things like that. So that's always our most current version, which works great for us.
Mm-hmm. That's great. Yeah, it depends on the pharmacy type. Some do like having it electronic, and I love it because you could control F anything. Whereas some still prefer the hard copy. I always say keep both because if an inspector comes in and they're walking around, that's the great tool to have available for them until your computer boots on. But the virtual one is, or the electronic copy is the one I would probably update more frequently. Do we have any questions from any of our attendees or any conversations you'd like to join in on?
I'm in the chat log here looking for something that looks relevant.
Hi, Peter and Elizabeth. Can you hear me?
Yes.
Hi, my name is Nancy Fingerhut. I'm from Lee Soulsby Compounding Pharmacy. Both of the suggestions were really high value for our pharmacy, and we've taken a very similar approach, keeping conservative policies. But a current issue we're grappling with is it's now 2021. A good portion of our staff members are vaccinated and want to travel. So how do we change our policy and sort of address this new feel among our staff members who are eager to go out back into the world?
Oh my God, Peter, you want to take a dab at that or do you want me to? I mean, as you're telling me, I'm looking up CDC travel to see what their most current recommendations are for traveling. I know certain countries have restrictions.
I added some of the recommendations in the chat. So currently, if this is still relevant, from when I last reviewed it, it's a full 7 days after travel in self-quarantine.
I think it's different in my opinion. I think it's different when you go through the CDC website for each country that you'll be traveling to and from. if I were to develop a policy about my staff personnel traveling, I would include testing in there, which test I would want them to take, how many tests I would want them to take before they return back to work, if there's a period of quarantine, and exactly where they visited. So I just went on to the CDC travel, and I'm looking up a random country, Austria, to see what the CDC says about that. And so the CDC's recommendation, they list levels. For examples, it says level 4, COVID-19 very high. Travelers should avoid all travel to Austria. So I would probably write a policy procedure that says, please refer to the CDC guidelines on the risk levels associated with that. And based on the risk levels, please talk to your employer to make an assessment. I wouldn't write a solid PMP that's going to be in place for all travel purposes.
We currently have language in our travel policy that highlights that. My question is sort of surrounding, like, they're flying down to Florida for some beach time. They're getting on a plane. Do we have to default to the CDC guidelines of like stay at home for 7 days, or can we implement sort of like a testing method?
Has your staff member been vaccinated or the unvaccinated? So I think that would make a big difference.
Yeah, no, that's a key question. So we have staff members that are vaccinated and also have previously recovered from COVID infection with a similar situation in this example.
I'll just tell you what we've done is we've really defaulted to the local guidelines. So we actually, San Francisco had a travel restriction for our region. So if people left the region, they would have to self-quarantine for 10 days. We actually enforced that with our staff, but we did it with the, we're not doing this. This is the county doing it. I don't know if I could put a policy together to not let my staff travel. That probably isn't going to go over too well. So we're really defaulting to kind of like what Elizabeth said, the CDC guidelines. We have a way that staff member travel to safe, so if somebody's going to fly to Florida to go to spring break, we've seen the pictures there and it's like, oh my goodness, this could be dangerous, even with a vaccinated person. I think it's a conversation to have about, how you're handling yourself and making sure that, everyone wants to travel. So it's going to be hard to say you can't travel or, I'm going to put extra restrictions on you that go above and beyond what CDC is allowing. But hopefully we can at least encourage everybody to travel responsibly, understand the risk that they're taking. Being vaccinated helps because, technically speaking, that's a big change. However, it doesn't mean that you just go crazy and engage in risky behavior too. So it's a tough question, and I don't know if my answer really gave you clear guidance, but that's kind of what we're relying on now is just the guidance for where people are traveling, and we're going to encourage people to be thoughtful about it.
So I'll answer again from the perspective of if you were to call me and say, hey, can you help me draft a policy and procedures on travel, what I would include? I would say if you are eligible, get fully vaccinated. First and foremost thing would be the number one thing on that policy for COVID-19. Before you travel, get tested, viral tests, 1 to 3 days before you travel. Just for the obvious reasons. I would encourage them, not require, but encourage them to wear a mask around your nose and your mouth when in public. Crowded areas, I would say avoid crowds, maintain social distance, 6 feet, 2 meters, giving them some cleared. I would also say get tested obviously after your travels, and I would do a full 7-day stay at home according to what the CDC requires. And in addition to that, I would say, if obviously you don't get tested and you don't want to get tested, you can self-quarantine for 10 days. At the end of all this, I would say just follow your state state recommendations and requirements after travel, because every state is a little different, every area is a little different, so you don't want to limit people. I would just kind of enforce the things that I think are most important, whether you travel or not. Masks, social distance, and vaccines, and the rest leave it up to them and their state requirements. So you're kind of hands off as to what you're forcing your employees to do. I hope that answered your question.
Yes, it did. Thank you. Thank you both.
Any other discussions, or anyone have any fun ideas to share with us on what you're doing with COVID?